Ladies and gentlemen, you are watching Dr. Kalisa on Doctor's platform. So I'm here to health educate you about diabetes, but specifically on how you can take care of your feet, about how a patient who is diabetic can take care of their feet or his or her feet. But before I talk about that, I would want to first explain what diabetes is, because some people don't know what is actually diabetes is all about. Normally, diabetes comes due to the improper metabolism of carbohydrates or glucose. In simple terms, if glucose is not balanced well in your body, because in your body there is a mechanism which is there to make sure that glucose is maintained at a normal range in your blood. Normally when you eat food, and this food containing carbohydrates, for example, if you eat cassava, matoke, chapati, all those foods I've talked about, they contain carbohydrates. So when you eat them, they are broken down into a final component which we call glucose, and it's that glucose which enters into blood. So when that glucose enters blood, the normal range of glucose in your blood should range from 3.5 to 8 millimoles. It shouldn't go below 3.5 and it shouldn't go above 8 millimoles. So what happens if glucose goes below 3.5? If it goes below 3.5, there is a hormone which we call glucagon. That glucagon comes and starts to convert the stored glucose in the liver and in the skeletal muscles back to glucose, such that you can get enough glucose because it has gone low. But again, if it goes above 8 millimoles, that is abnormal. So what happens is that the pancreas produces a hormone which we call insulin. This insulin comes and converts that excess glucose into glycogen. It's that glycogen which is taken to its stores in the liver and in the skeletal muscles, and glucose goes to normal. But there is an incident whereby you have eaten a lot of carbohydrates and the carrier capacity of glucose in blood of 3.5 to 8 millimoles is full, and even glycogen stores in the liver and in the skeletal muscles are also full. Those stores are full, and glucose is still high. That is abnormal, and the body cannot just look like that when that abnormality is going on. So what happens is that the pancreas produces insulin, which starts to convert that excess glucose into fats. So those fats which are formed from the excess glucose, in males, those fats are brought and they are kept under the abdomen, because under the abdomen there is a layer which covers the intestines. That layer, we call it omentum. So they are stored there. So, and you say man, his stomach stands to extend. Locally, some people, when their stomach become big, they say that man has got money, but it is normally, but it is simply fats which are stored there, because that person maybe is not doing a lot of work. His work is sedentary. He just sits in the office, he eats a lot of carbohydrates, and the glucose which it takes in is not used. And when it is not used and it is in excess, it is converted to fats and it is stored under the abdomen, and your stomach or your abdomen extends or becomes big. But in females, those fats they are stored at the hips. So in such a state, the woman, her hips will become big, and they are also stored under the skin, under the breasts. That is in females. So all that work is done by the insulin to make sure that glucose is maintained at the normal range. So if glucose or if insulin is not there, or is not enough, or is there but it is resisted, it is something which is resisting it to do its work, or it is there but it is deformed, because insulin may be there but when it is abnormal, insulin may be there but when it is abnormal, it is not functioning. It may be there but when there is something which is resisting it from performing its work, it may be there but when it is not enough, or it may not be there totally. And all those factors will make glucose go high. And when it becomes high, we shall say that person is diabetic. So, but now here we are focusing on, I'm focusing on teaching you or teaching diabetic patients on how to take care of their feet. Because we see that a person who is having diabetes faces a lot of complications, because diabetes has got various complications. One of them is that diabetes damages the heart, diabetes damages the brain, damages the eyes, damages blood vessels, diabetes damages kidneys. So a person who is diabetic, his blood vessels reach a time, if glucose is not well controlled, and those blood vessels fail to do their work efficiently. And the work of the blood vessels mainly is to transport blood which is containing the nutrients of which body cells need. In simple terms, body cells, they get what to eat by the action of blood vessels bringing those nutrients, providing those nutrients to them. So, if the blood vessels are not functioning well, the body cells will become starved. In medical, we call that ischemic. They become starved, and when they become starved, the nerves will become damaged, and the person will lose their sensation. And when a person loses sensation, something can prick that person, and he does not feel any pain, because the nerves are not functioning. Even if you prick that person, you just keep on moving. He's having a wound, the nail has pierced that person, but he's moving. He's not even aware he's having a wound. He can even possess that wound for like a week without realizing that he's having a foreign body. The nail may even remain there, but the person is moving, not knowing that he's even having a foreign body. Oh, the foreign body may not be there, But after one week of realizing, because there is no pain, the person is not aware. So after 1 week of realizing that there is he has got a wound, sometimes the wound may be small and the patient may not be bothered of taking care of the wound. So in some people, what comes to their minds is that it will heal on its own. So the person stays there and bacteria come and enter and infect that wound. So when the bacteria come and infect that wound and blood supply is very poor to that wound, the healing process cannot take place well. So the wound starts to increase. Okay? So the bacteria continue to eat the wound, and that one can lead to amputation. We may end up getting what we call diabetic foot, and the patient may be exposed to amputation. We may end up cutting off his foot. So it is very important for a diabetic patient to know the principles governing their feet on how to take care of them. 1, a person who is diabetic, he or she has to check his feet daily. In each and every corner, he must check there. If he cannot see in the bottom of his feet, he should use a mirror to see there. 2, he or she must wash or should wash his feet with soap, and he or she rinses those feet with a towel, and after that you can get a jelly and he smears on his or her foot, but you should not smear in those corners of the toys. You should leave there. So 3, a person is diabetic, even if he or she is in his house, must never move barefooted. He should put on shoes which are open or closed, but if they are closed, they must be big enough to give that enough room for his feet to move freely within those closed shoes. But preferably, we emphasize them to put on these open shoes, because those one we can, if that person puts on open shoes, the feet are, they get fresh air, they are not squeezed, because some people don't know how to maintain their size. So if their clothes must be big enough, and you can use open shoes because they are good. Even in the house, you should never move barefooted. Another thing about taking care of the feet is when a diabetic patient should never sit while holding his legs. He should sit in a proper way where blood is moving freely. Okay? Where blood is moving freely. That is very, 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 very important. Okay? He must check daily his feet for any foreign body, because never know, something may be there. So that is very, very important. And he or she should touch or should feel the temperature, whether it is hot, cold, or warm. That is very, very important. Okay. You should also look for ulcers or any broken skin. You can use a mirror to look into the middle of the feet. That can help also. Okay. Another one is you can wear warm and comfortable socks or stockings, preferably which are cotton and not nylon, which cuts can interfere with blood circulation. So those principles or those criteria, they are very, very important. But in the case of any abnormality that the person realizes, he should contact his doctor, because if he does not contact his doctor and he has got a problem with his feet, that one can lead the patient to amputation. Really? Okay. So, with diabetic patients, in regard to the care of their feet, they should avoid shoes of high heels, strapless, and backless shoes. Tight socks must be avoided. Too hot water towards the legs, because they can burn you when you're not even feeling any pain. So the person who's diabetic should avoid hot, very hot water. You can get a caretaker to get for him or her warm water, which is good for him or her, because sometimes if he's the one, something can burn him and he's not realizing, because the nerves were affected by diabetes. Okay, and that is called neuropathy, because nerves are not functioning. So if legs are too cold, don't use hot water or heater bottles to warm the feet, because they may be, those hot bottles can burn the legs without you realizing. Okay. Never sit or never expose. A diabetic patient should never expose him or herself to fireplaces. That one is also very dangerous. Sincerely. A diabetic patient should check inside of his shoes for any foreign body which may exist. So, usually, a diabetic patient buys shoes during the afternoon for a good fitting, because in afternoon, legs are fresh and they are not swollen, If they are swollen a bit, because in afternoon heat is a bit high, and sometimes in the afternoon legs they are distended a bit, because blood vessels they have dilated. So, and when blood vessels dilate, there's some leakage of water and there's some swelling of the legs. So when he buys in the afternoon leg, because at that time we expect the legs or feet to have a distance a bit. So when you go there, legs they are big to their maximum, and you can get enough and fitting shoes for yourself. When you are cutting the nail, the patient, when you are cutting the nail should be cut straight. Okay, with a nail cutter. should be cut straight with a nail cut and not a razor blade, because the razor blade can cut you easily than a nail cutter. Because what we are avoiding is any wound, however small it may be. That's the main target. So normally these diabetic patients, we teach them on how to detect sensation in their feet. If there is any sensation, using the filaments, okay, using filaments or cotton wool or pins, teach them how to detect any sensation, if it is there or it is not there. That they can take care of themselves very well. So, because in maintaining good care of their feet, it is of paramount, because in most cases, for the cases we have got, that we have seen that feet, they have always become the victims, and it's the most leading cause of amputations in people with diabetes. So taking care of the feet in people with diabetes is very, very important. So I urge you to always follow our platform, which is known as Doctor's Platform, where we talk about various pathologies concerning our health. Because when people get to know how to take care of their diseases and other pathologies, that can increase their lifespan. But it is very dangerous person to be suffering from a chronic disease like diabetes, pressure, HIV, ulcers, cancer, asthma, and the other chronic illnesses. But when it doesn't know really, he doesn't know how to take care of, because this care, which is routinely at home, sincerely it prolongs the lifespan of the patient, not merely the medicines. Okay, because we may give the medicines and the person is not taking care of him or herself, is not health educated, still the medical side, the process will not be successful, because the process of treatment involves the doctor, the patient, plus also the caretakers. And if the doctor plays his role of health educating the patient, and the patient is not taken care of, and even the relatives or the caretakers, so the line of curing or controlling or preventing or increasing the lifespan of the patient becomes reduced. So thank you very much. Dr. Kalisa on Dr. Platform. I've been talking about on how to take care of the feet in people with diabetes. So if you want to access me, I'm located in Namgongo Division, near the Shell, Kireka Namgongo Road. Or you can also reach me on my number, which is 0756 36 5582, or on my email known as kalisatanas@gmail.com, kalisatanas@gmail.com. But normally my number is 0756 36 5582. 82 for any question or any comment. But for any comments are welcomed. So we shall meet another time for another discussion. Thank you.